So just as a reminder, on the panel we have Delta Police Chief DeBoard. We have Sergeant Dave Von Smith, who's a drug expert with Delta Police. We have Dr. King, Mr. Goheen, and we also have Assistant Superintendent Brad Bauman. So I'll kick off with a question that several people have asked. Probably address it to Sergeant Von Smith or Chief DeBoard, which is, how and where are the dealers getting the ingredients to make fentanyl, or where is it coming from? And would large purchases of ingredients be a red flag?
What we're finding is that the majority of the fentanyl that's probably being used illicitly is not from a legitimate source. It's coming from overseas, smuggled in through the ports, smuggled in through customs. The problem with fentanyl is it doesn't take a lot of fentanyl to produce a lot of street-level drugs. So, for instance, well, if you think of the 2 grams salt, or the 2 milligrams or 2 grains of salt is enough to kill you, think of what a pound of fentanyl could go. So, I mean, dealers, it's all about making money for these guys, and that's why fentanyl is so lucrative for them. A small amount goes a really long way and produces a lot of drugs. So fentanyl it can be easily smuggled in just because of its size and the way it is packaged and created.
There's a second question here. So current use of drugs seems, unfortunately, like it's acceptable in wider circles. Is there any general sense, or do the police who are dealing with it have any general sense of why more people are making this choice, or of what the draw is? And really, I mean, that's going to be open to anyone here, I think.
I'll start off by being able to say that we don't think that drug use, as indicated by some of our speakers here this evening, has increased at all. We just think the dangers to drug use have increased as a result of fentanyl. So that's an important thing to say. We don't think there's an epidemic of drug use within our communities. We think that the fentanyl issue around drug use is what the epidemic is, and potentially the biggest risk for our community. And I'll turn it over to potentially Fraser Health here. Any comments? No?
Did you deal with that, Mark?
Yeah, I think that's well said. That, the message is that, we go back 10, 20, 15 years ago, before there was fentanyl, and it's, we're finding it everywhere right now, is that it's not to suggest that drug use is something that we're trying to suggest is safe. However, the chances of ending up dead over a single experimentation were quite low. That's just a reality. Now the chances have grown dramatically, and that's just the reality of it. So in the past, experimental drug use would not likely result in death. Right now, we're seeing it happen on a daily basis.
Thank you. A question for Chief DeBoard. There's a question on the 9 overdoses in South Delta, and have police been able to catch, or have police caught or advanced their investigation into the dealer that sold the drugs to the 9 people that overdosed?
Great question. Yes, we have had some advancements in that particular file, and we certainly are actively still investigating it. There has been arrest. That person has been released at this point in time pending further information, but we're actively pursuing further evidence that will assist us in being able to bring the case forward to the Crown. So at this time, I can't say there's any charges, but certainly that is something we're looking at down the road, and we continue to pursue aggressively.
And sorry, just a reminder as well, if anyone has any questions, you can put your hand up. We do have somebody with a microphone. There she is. Somebody up there with a mic. She's dressed in black. It's pretty hard to see this way. But if anyone does have a question, just throw your hand up and she can bring the mic around as well, and we can ask that question. Another question for the panel. What is the touch risk of fentanyl or drugs spiked with it? Like, what are the handling risks for either users or family members or first responders?
I think, again, because such small quantities can result in overdose, so the equivalent to 2 grains of salt, there are risks related to handling this, and the police can tell you about their procedures that they use when they are handling illicit drugs. That being said, if you do find drugs or you suspect there are drugs in your home, Again, do not handle them with bare hands. Do not put your fingers in your mouth after touching them, although it can in fact even be absorbed through the skin as well. You certainly can contact the police. That's probably the best thing to do, and they can advise on this as well.
I'll provide just a little bit of input with regards to some standard procedures we're using when we're dealing with fentanyl. The first thing is we use double sets of gloves. So you'll see 2 sets of rubber gloves. You'll see long sleeve shirts, typically, so that you can't take anything, into the forearms. In addition, there will be a mask of some sort to be able to protect any airborne particles that may be in the air. And did you want to add anything, Sergeant?
No, the biggest thing I was going to add to is just that contact can cause it to be absorbed through the skin, and that's a problem for all first responders or people who might come across drugs that they suspect fentanyl are in it. So again, no handling whatsoever when we're seizing the stuff with bare skin, and we're extremely careful on how we process it.
And along that same line, question, how can I recognize fentanyl or drugs with fentanyl in them? Can you guys put on your website pictures of drugs so that we can look at them and see what they are and if fentanyl's in them?
No, the problem is that drugs today don't look any different than they did 5 years ago. There's no way of telling what drugs have this fentanyl in it. It's odorless, it's colorless, and if you think, again, the 2 grains of salt, thinking that, that can easily be concealed in whatever they're taking. So when we seize either heroin or cocaine or fake oxys on the street, we have no idea until we send it to our Health Canada lab for testing, our CMP lab for testing, until we get the results from them. We just don't know even if it has it in it. So as safe practicing right now, we're assuming anything we seize could have it in it.
Thank you. And I think there's a question from the audience up there.
Yeah, hi. Thanks for all the information. I was curious, what's currently being done to protect kids in high schools in Delta currently?
Great, thanks for the question. I think as Superintendent Shepherd alluded to, we're learning a lot right now. And so I think with the urgency that I think's been conveyed tonight around this real change, it's a change. We no longer can feel safe that if kids are coming into contact with drugs or experimenting, that they are going to be fine. And that's a huge, huge concern for us from an education standpoint. Our secondary schools do a lot of work either through prevention programs where kids would maybe even come into a large assembly like this and learn about the dangers. Certainly we're looking at how to best deliver this information that's new, that's been shared tonight around the dangers of fentanyl. But I think it goes deeper than that in the sense that many of our students will not necessarily seek the help out that need it. And I think, it sort of reinforces the notion that are those protective factors of the relationships with the healthy adults in their life that they need to be connecting with around this. So it really is about the folks at the school level, home, community, being receptive to listening to kids who want to talk and helping them with resources. I think for kids that are experimenting and using drugs, one of the things we see from the school level is the challenges people like counselors have getting them to engage with services. So we have services available in our community. The challenge sometimes is getting those kids to engage, and that's where the family and other significant adults can be a huge help. So it's really about us working together around that. But back to your question around the education piece, we are working on some ideas around how we could deliver this information in a sensitive and appropriate way to multiple groups of kids.
Actually, just before I take the question from the audience, along those lines, we had a question come in. What is the provincial government response on this? On the hot seat.
You think I almost knew that was coming or something?
Well, thank you, and I guess that was timely. Well, first of all, let me start by saying I hate the fact that I'm here right now talking about this issue. It's a crisis. It's been identified as such, but let me start by saying, the people that are in this audience right now and your children, you're probably the people that got it right. I think you've got it figured out and you know the direction you want to take, but you know there's thousands more kids out there right now that you might be able to help. You might be able to represent, you might be role models for them. So, as was said before, if you have the opportunity, please help your friends. This is too important. Okay, I'll go to the answer the question. This is an issue that we don't want to have to respond to in the sense we want to get in front of. You know, we want to stop this from happening in the first place. Yeah, we can put, we have, and we're in the process of putting treatment beds, young people with addictions, we're moving forward with that. We're implementing more, but, you know, the fact of the matter is, and was said earlier, this is too important an issue just to treat after it happens. We need to get out to the community. We need forums like this. And by the way, thank you to all the panelists and the mayor this evening. You did an exceptional job. We're trying to educate a community, but this is grassroots. This is where it has to happen. We have extended the naloxone opportunities to firefighters in Delta and throughout the province. In fact, I mentioned to the mayor, the Union of BC Municipalities Convention is coming up in about 2 weeks in Victoria, and that's where all of the local governments have an opportunity to lobby the provincial government on particular issues, and they will take emergency resolutions from the floor. And I suggested to the mayor a little while ago that it might be a great opportunity to advance the thought of providing naloxone to our police officers. So it's something that it's prevalent, and it's, again, I say it again, it's an emergency. We have to deal with it, but you know, we look to the grassroots of a community for help, because this is really where it begins. This is really where it's going to end. And thank you all for being here this evening, and if I can answer any more questions afterwards, I'd be glad to. Thank you.
Thank you. I'm going to take a question from the audience there.
I just have a quick question for Delta Police with regards to their approach on just general community members calling in with low-level street drugs being sold on their streets. I personally have an experience where we have called in and have not, or did not get a response from Delta Police. And I think it puts us as hesitation as community members to report it the next time we see it, because I don't want to be wasting, you know, to me it felt like I wasted almost 2-3 hours trying to reach an officer.
Thank you for providing some feedback for us. Certainly, I think we do take the no call too small approach to most of our calls, meaning that we do bring in all those calls and we do have some sort of response and create a file for that we can begin to work on. Sometimes some of those calls end up going over to our drug section and they have background work. We often see calls that come in that there's another project working in the area. As a result, they may not have a direct response with a uniformed officer to that particular call on the street, but there's background work being carried on. And I'm going to turn it over to Sergeant Von Smith a little bit to talk about that as well, because often that background work comes from sort of the detective section that he works from.
Yeah, drug investigations generally don't occur in a day or two. Quite often they're very lengthy in terms of 2 months, 6 months investigation with a lot of moving parts in them. So unfortunately, proving someone is doing drug dealing takes a lot of resources and different investigative tactics as well. So they're generally files that don't get solved in a day. We do take all files seriously, and we investigate all the files that we do get reported.
I'll conclude sort of our response to that certainly if you feel you haven't received an adequate response, please do give us some feedback. There's a couple different ways you can do that. Certainly through our website, there's a contact the chief's office that you're welcome to be able to use at any particular time, or certainly call into the office and any one of our team will be able to at least provide an answer and provide a response to that particular issue.
Another question, slightly different topic. Can police dogs detect fentanyl, and is there a risk for them?
At this point in time, fentanyl does not have an odor, and there's no police dogs that can connect or can detect fentanyl. So we don't have any ability for a K9 unit or a K9 team to be able to detect fentanyl.
And I think certainly on that notion as well for police dogs, some of the reading I've done in the States, there are places in the States where the officers are not actually sending their drugs to do some searches because they're worried about the reactions on the police dogs as well. Second one, is ownership of a pill press legal in BC?
I'll start this question again, turn it over to Sergeant Von Smith. It's illegal to be able to, it's legal to be able to own a pill press in British Columbia. When we talk about our response to these particular issues, we talk about whether we can use enforcement, whether we can use partnerships, awareness, or in fact legislation as well. Part of the legislation we would like to see changed is similar to Alberta or other provinces in Canada for pill presses to become illegal within the province of British Columbia. So currently you can order a pill press from overseas, have that pill press delivered in BC, and begin to make your own pills, which can produce up to 4,000 or 5,000 pills per hour.
I think you pretty much covered it on that one. Yeah, we are seeing pill presses, and we're seizing them at the factories. And like Chief mentioned, people are turning their little drug labs into producing what looks like pharmaceuticals. So we are seizing them, and they are out there.
Question from the audience up there.
Hello. I understand that the families play an important role in solving this problem, and I'm just wondering, is there any connection between the financial status of the families and the use of drugs?
So the question is there a connection in the financial status of the families and the use of drugs? Yes.
We certainly know and will continue to reinforce that we believe it is a money-making venture. The people use fentanyl, they're able to produce more volume of the product and get more profit from their product by being able to cut other drugs with fentanyl because it's very cheap and very potent, and as a result you get a significant high with not as much drugs. So the financial aspect of it, we work closely with Revenue Canada, we work closely with other agencies that do have abilities to be able to track money, such as Dun and Fintrack. Is it terrific? I've got to be able to stand up here and say it's not terrific. It's very difficult to be able to get these cases in front of people that can actually take action on it. However, it is something we do. In addition, we do have tremendous powers within British Columbia through the civil forfeiture, and we're able to seize houses and cars and all kinds of different assets. And that is a great tool for us, and I know that we've used it here in Delta very successfully.
Chief, I know that was one side of the financial question, and I think the other part of the question was, is there any link between income of the families of users and what we're seeing from a user perspective, or is it anybody, anywhere, anytime?
No, it's not. It can be anybody, anytime. It can be a person who has addiction issues living on the street. It can be a wealthy family with a son or daughter who decides to use drugs for the very first time. It doesn't discriminate.
I'll just jump in. I think going back to the education piece, you know, obviously when we make comments like this is a game changer, I think that's where the concern really sits with us, is that this really doesn't discriminate. And we know drugs are out there at parties, and if teenagers and young adults are at parties, they're likely potentially exposed, whether they're using or not. We know, we've heard tonight about the dangers of that, but I think from an education standpoint, what is really important is that kids don't think there's some stereotype attached to who is using out there. It really doesn't discriminate, and the graphic that Dr. King shared, I think, really says it all, and that's kind of the message we want to get out there with kids. And certainly for all of the students that joined us here tonight, it's really great that you're here to hear this, and I think a message you can take away that I hope you will is to share this information with your friends. And when you know that there's somebody you're close to, or a friend of a friend, that might be trying or experimenting with drugs, we want to give them lots of reasons, and that you will tell them to try and avoid using. Stop. So this is a game changer.
Great. A question for Sergeant Von Smith. and this is one that's come in a lot and that I've seen a lot, through media and through conversations with the media. Why are dealers putting fentanyl in the drugs? And the one that I always see is, isn't it bad for business to be killing your clients?
The reason we're dealing with fentanyl here tonight is all about money. It's turned into an extremely profitable thing for dealers to use fentanyl instead of heroin. A little bit of fentanyl goes such a long way that they can produce an incredible more amount than using genuine heroin or genuine oxycodone, that it has become extremely lucrative for these dealers to produce counterfeit versions of the drug using fentanyl. So again, the only reason we are here today discussing this is about the greed of drug dealers trying to make more money.
A question actually that came in for MLA Hamilton. I see you there now. There's a question here. Youth are being turned away from treatment centers, and does the government plan to increase funding for treatment?
The simple answer to that question is yes. The government is committed to 500 new treatment beds. We're well on our way. I think we have somewhere around 230. But I'm going to go back to my earlier message. I really don't want treatment beds. I don't want naloxone. I want to get in front of the message. As a government, we really have to work on educating ahead of time and make sure that people understand the risks that they're taking, the Russian roulette that they're playing. I'll ask anyone in the audience, if you had a revolver, would you put one bullet, spin the barrel, and put it to your head? Because those are the chances you're taking. Maybe 1 in 6, I don't know. Chief, you could probably answer it better than I can. I don't know what the drug use is in terms of the actual overdoses that occur. But it's a terrible game. But again, just go back to your question. Yes, we have committed to more beds, more treatment beds, but I think the answer, in my opinion, is prevention, and we will be putting efforts into that as well. Thank you. Ann?
Just want to elaborate on that because I fully agree with that comment. Is an ounce of prevention is worth a pound of cure when it comes to this problem. And one of the challenges is, to be perfectly frank, is that the evidence related to the impact of treatment is slim. And there are many, many conditions for which treatment just isn't an option because it doesn't work. And although we do need, of course, to continue to improve our treatment of many, many diseases, prevention often is not only the best way, it is the only way of being able to deal with many of our health problems. So I just want to reiterate that point. And while I have the microphone, I would like to say that there is a group that is particularly of concern, and these are our vulnerable youth. And who are our vulnerable youth? Our vulnerable youth are the ones that are not feeling that they belong. They don't feel that they're necessarily loved. They don't feel that they have any opportunities, and they don't have the support that is required. It does take a community to raise a child, so we're all very important in terms of ensuring that we have as few vulnerable youth as we can within our community. Thanks.
It's unfortunate to hear that any youth who is reaching out for help would be turned away, and frankly, I personally would like to hear more of those details and to find out what went wrong, because that is not acceptable that would ever happen. I want to make it very clear that in Delta and in all of our communities in the Fraser Health region, we do have a continuum of care, and we have Delta Assist and PCRS, and I am confident that if anybody contacted either of those resources, they would not only be welcome, but they would have a very receptive and real response. There are some resource cards that I believe, is that right, Aaron, that we have on the tables, and that also includes, does Leanne Radmore's number is on there? Leanne Radmore is a point person for youth services, so if there's anybody in this audience, or you know a friend or someone, for whatever reason, is not receiving the kind of response that every youth in our system of care deserves, I'd really encourage you to contact Leanne. She's a sort of like a travel agent extraordinaire in terms of trying to help people navigate our system and get the resources. But there are resources out there. That's not to suggest that we have enough resources, but there are incredibly skilled people out there that are committed to helping youth.
Thank you. I'll take a question from the audience up there.
What is being done to intercept the drug at the borders and the ports of entry?
Well played, well played.
Yeah, we did have this question last night as well, and Chief DeBoer alluded to the fact that, I mean, we do have special teams designated to work the ports. We have seconded members to work with teams at the ports, and obviously CBSA has their own mandate of working at the ports. Like I kind of spoke about earlier, the fact that fentanyl does cause issues, being that it is such a small, pure substance that it is easy to get into the country. It can be, I mean, the smugglers are very creative on how they disguise the substance when it does come in. It's controlled in Canada, but unfortunately, they might not have the same controls overseas, and that's the way it's coming into our country.
I will add as well that if you take out your smartphones and look at the size of your smartphone here tonight, that size of fentanyl will go a very, very long way. So you can just imagine, whether it be in cargo containers, whether it be in packages that are mailed, in all kinds of different methods, that the people that are doing this are very, very creative, and that's how they make their money, and they spend all their day thinking about how they will get it into the country. Our integrated teams at the ports do help out. There is some enforcement there. I couldn't stand up here and say that we're doing an excellent job there. I think we're doing an adequate job, and you can always do more, but certainly that's where some of it is coming through.
We've had a couple of questions, and we had some questions last night about this as well. And I think a lot of parents are concerned about this, and this is something I think with Halloween coming up and kids back in school is always a concern. Can food or drinks be spiked with fentanyl, and is there that inadvertent risk? It doesn't specifically mention Halloween here, but I know every year you'll see some news reports of somebody getting something in their Halloween candy, or parents to check it first. So I think that's a concern for a lot of parents. Can food or drink be spiked with fentanyl? Is that something we're seeing, or is that something that we expect?
We're not seeing it. Again, the amount of fentanyl required to make another substance or piece of food or anything like that toxic is very little. So I'd say if someone is openly doing drugs in the same area that someone's consuming food or candies or beverages or anything else, it could be contaminated. We aren't seeing it in food or drinks or anything at the time.
I think there's another question somewhere.
Just back here.
Up in there we go.
Hi there. A tool that can be used to be proactive for parents is drug testing, but they're quite expensive. I'm wondering, for $65, is there not a way that, parents can have that waived so that helps us to keep our children away from the drugs?
Was that in reference to naloxone? Is there a way that parents can get naloxone or Narcan cheaper?
No,
or
it's
was
more
it
towards the drug testing, because it's a tool for parents to help, keep our kids away from drugs.
And let me just clarify, are you talking about a testing strips that parents can have, or are you talking about some sort of testing where a parent's able to take a child's urine sample or something along those lines?
Exactly, or even through your doctor. Like, if we have to go to a doctor, it's $65. It's not covered.
So right now, there are two ways to be able to get naloxone. One is through the provincial take-home naloxone program that I mentioned that is operated out of the BC Centre for Disease Control. And there is a huge amount of work being done provincially to try to improve access to take-home naloxone kits, which are administered free of charge. So right now, the availability is for people who've had a current or a past history of using substances and have in fact completed the training. Although I have to say that within Fraser Health, we are working hard to try to improve that access and get as many sites as possible for free take-home naloxone. But this is a collaboration between the province and Fraser Health. And so we do understand that this is a cost to folks who often can't bear that cost. So the other way, though, that you can get this is through pharmacies as well. As I mentioned, it does come at a cost, though, and I'm not entirely sure how much. It probably varies somewhat from pharmacy to pharmacy, but the training can be provided by pharmacists right now. So if you walk out the door, you can go probably to your local pharmacy and obtain that over the counter. However, that all being said, I think we do all appreciate the need for more free take-home naloxone kits. All of our emergency departments are providing it right now, and we're expanding all of our sites on a weekly basis, and in fact are closely monitoring the expansion of the take-home naloxone program. So stay tuned. We're working hard at it, and we'll continue to do that.
Great. And I think one final question here. We're going to wrap up, but we hear a lot about naloxone or Narcan, and indeed we've talked some about it tonight and how it can reverse the effects of an overdose. There's a concern that there's a danger in us saying that, where it sounds like if somebody's using drugs, Narcan or naloxone is the be-all and end-all, and if people are going to be casual users anyway, if they just buy a naloxone or Narcan kit, then they can continue using safely in their minds. What would you say to people, what would your advice be to people who believe they'll be okay from a drug overdose as long as they have naloxone or Narcan on hand?
Well, our experience, is that the use of Narcan or naloxone does not, in fact, encourage opioid use at all. And so I think, that is really a very important message. And people who are using often, there's obviously various reasons for that to occur, but it certainly doesn't encourage drug use, and it is the best antidote we have right now for drug overdoses and why we need to continue to expand its availability. I don't know, Mark, if you want to make any more comments with your experience with addictions medicine as well.
This is a really important concern. And by the way, it makes sense that we ask these questions because we are concerned about people. And sometimes it's helpful to step back and look at the evidence. So first of all, this question has been well researched. There's no evidence that this happens. I can say in my own experience of working with thousands of people with serious addictions, I've never met anyone who developed addiction or used drugs because someone made it safe to do so. It's much deeper than that. The other piece, and I think it's analogous to, and there are some debates, is that by putting seatbelts and airbags in cars, are we encouraging people to drive recklessly? And maybe there is some people who take risks because they know have an airbag or seatbelt, but I'm not aware of any evidence to suggest it. But the piece I think we need to hold on here to is that no matter what we believe or what we think, young people, and this has been going on for thousands of years, sometimes do things that are dangerous. And that's probably not going to stop soon. And in the unfortunate event that a young person makes a decision that ends up dangerous, we want to keep that young person alive. Because when someone is alive, then we can reach out and we can try to help that person get safe and safe well. So our first business here, though, is to try to make sure that the people that we care about, the young people in our community, stay alive. And unfortunately, that's why we're talking about naloxone, is that we first need to preserve life.
Thank you. I think that's a great place to end the panel. I'm going to turn it over to Chief DeBoard for closing remarks. Please don't worry if we didn't get to your question tonight. I have them all on this very official filing system of mine. We will make sure we get those all answered. And even any questions from the audience, you can email us, media@deltapolice.ca. Contact us via these ways. Just go on the website, look up one of our addresses and send them. We will gather those questions and we will make sure in the coming weeks we have answers, we have resources. For those we don't have answers to, we will find the people that can answer it for you.
Great, thanks so much for all your work tonight here, Sarah. I'd be remiss if I didn't start by being able just to provide some thank yous. And first of all, to the Delta School District and Superintendent Shepherd, thank you for all that you've done to be able to organize these forums, and they've been tremendously successful due to your and your team's help, so thank you. And certainly to Fraser Health and Dr. King, thank you so much for your help as well. I also just want to say thank you to the team that helped put this all together. I mean, it came together fairly quickly when you think these overdoses occurred just on September the 1st. And here we are today talking about them in a significant form. So as I start here this evening, I'm here with mixed emotions, and I too share Mayor Jackson's frustration that she feels, but I'm also very hopeful. I'm very hopeful because of the amount of youth I see and young kids in the audience here this evening, in addition with their parents that are willing to be able to be part of the community. I will echo what Scott Hamilton has said in relation to the fact that many of the people that should be here are not here, and I think we all know who those people might be. So I'm frustrated when I read overnight reports almost on a nightly basis for the Delta Police Department, and I see that, in fact, there are other overdoses and youth that are overdosing in our community. I'm frustrated that we commit so many resources from the Delta Police Department to be able to take drugs off our street, and yet we're really having very little impact, and we're certainly not winning that battle. I'm frustrated that we have lots of resources and assets within our community that in fact could be accessed by people if they knew how to get the help they wanted and had the confidence to be able to step forward and knew that there wasn't going to be any kind of stigma associated to it. But I can tell you one thing for sure, that handcuffs will not solve this problem. We'll never arrest our way out of it, and I'm certainly far more optimistic about partnerships rather than punishment. So why I'm hopeful is that, in fact, tonight we heard from many of the experts. We heard from experts from our drug section. We heard from experts from healthcare. We heard from the school district. We've heard actually from the community as well how important this all is. And we've heard from our mayor and how important it is for the quality of life in this particular community for us to be able to come together and be able to look at all the ways that we can impact it. So tonight, what's different about tonight than all the other sessions that you often see with regards to forum, whether it be a gang issue, whether it be a drug issue, whether it be a shooting issue? We have these forums, and really, what happens at the end of it? So I know the cost of entry here tonight was free, but really nothing in life is ever for free, right? We know that. So here I'm going to make a challenge out to everyone, and I hope that this will make it slightly different than some of the other forums that we've all attended. Is that my challenge to you is to have at least one difficult conversation with someone you really care about, whether that be parents to kids, whether that be brother to sister, whether that be friend to friend. The real tragedy about this evening would be if we left here and did absolutely nothing. Then we've accomplished nothing. So this is a call to action. Make no mistake about it. This is definitely a call to action. The police will never take the foot off the gas in relation to enforcement. We'll continue to raise awareness. We'll continue to advocate for change around legislation and part of the first responders that are responding to this fentanyl crisis. But really, it's up to you. I know this audience is supportive. I know that we're here because we want to do something. But the people that need to hear the message aren't necessarily here. So what I'm asking isn't easy. It takes tremendous courage. And there are services, and some of the services you've heard about here tonight, that can help make a difference. So let me leave you with this. If you knew you could save someone's life by having this difficult conversation, would you do it? That's your challenge, and that is the price of admission for tonight. So please, go home, have one difficult conversation with someone you know needs it, and talk about drugs, because it's important for all of us. Thank you very much for attending.
Thank you, everyone, and have a safe journey home. And like we said, reach out to any of us at any time, and we'll get answers to your questions.